Hello, everyone, and welcome to The Big Idea. The U.S. mission to the Association of Southeast Asian Nations started this show because we know that in Southeast Asia, there are many, many leaders who have not only had big ideas, but have turned those big ideas into a reality, and they inspire all of us. And I am so excited today. We have a very special guest, a leader from Burma who has accomplished so much, turned so many big ideas into reality, but she's just getting started. So let's welcome her to the show. Hello, Hsu Myat, Dr. Hsu Myat. Welcome to the show.
Hello, Jason. Good afternoon.
Good afternoon. I'm so excited to talk to you. I was reading over your biography and we talked a little bit before the show, and wow, there's a lot to discuss. You have accomplished so much and you obviously care very, very deeply for your community, for Burma, for people, for the world. There's a lot of passion inside of you. And so my first question for you is, I know that you've dealt with mental health as part of your focus on health, not just physical body health, but mental health. We both know that some people in the world, they have a hard time getting motivated just to get out of bed. But you are super motivated. You're always doing things, learning things. What's your key to finding that motivation? What do you think makes you so passionate to keep working so hard?
Yeah, that's a kind of a good question, because you are not the first person who asked me that kind of question, because I've been doing a lot of walks here, and also I was too active, and I was always ready for any kind of opportunities, for any kind of community walks there. So my very first passion is to make someone or something around me to be better, not only physically, but also just maybe mentally. So because whoever beside me, I just want them to smile whenever they are together with me. So that's my first passion. And then now, when I become a doctor, most of the people I have to deal with are my patients. So as you know, patients are those who are feeling physically unwell already. So I try to help them not only with their physical condition, but also I try to talk to them. I try to listen to them to make them feel more comfortable when they come to meet me to seek the medical attention. So that's my passion originally. And for the other motivation, that I'm sure that you might be curious how I motivate myself. I'm also a normal human being. I have a lot of boredom. I used to get lazy. Sometimes I don't want to go to walk. I don't want to get up from bed, want to chill at home all day long. But whenever I think about that, there might be someone, or let's say there are some patients who need primary healthcare or medical attention out there. So I think I have to take care of them, because I am taking care of the community health of the patients who are living in the remote areas near our region. So whenever I think about them, I have to get up and I have to go there. So I got my motivation from the other people. And also another thing is that whenever I see the results of my action, like someone who was feeling so unwell, who got my help and who got my treatment, and when they become healthy again and they can go to their routine walk, they can smile, they can walk for their family. So that's a very great success for me. Maybe it was just a small thing, but for me, I feel so happy and I got motivation again, and I want to do that again and again in the future. So that's my passion, and that's how I get my motivation.
Well, everyone would like to have a doctor like you. And I love what you said about it's important to you that your patients smile. That's lovely to hear. Now, when were you growing up, were other members of your family in the medical profession?
Yes. I was brought up in a family with there were 3 doctors from my mother's siblings, and also I have 1 elder brother and 1 younger sister. They both are doctors, so we are all from the medical field.
It's a family business. There's a lot of
yes, sort of.
within your family. Now, in Burma, is it common for women to go into the medical profession?
I think so, because like most of the girls are interested in medical profession, not only because of the nature of work, but also because of the nature of the female humanity. Because like for me, I'm a woman and I love to care, and also I love to be cared. So the medical profession, not only just a doctor, but also for the nurse or some pharmacist or something related to the medical background, we have to do is to care the other people, to care what's happening to the patient. So I think that's one of the reasons why most of the females in our country, they choose to be the doctor when they grow up. It's not very much common, but it's mostly common. But nowadays, there are a lot of communication and also internet connection, also the global village, access to other professions. So many females, they don't choose the medical university for their profession, and they go way beyond, a lot further, like the aerodynamics, physics, engineers, a lot. So that's very good to see them going out of this shell. Yeah.
That is good to hear. There was a time in the United States when it was unusual for women to become doctors. Not anymore. Now it's very common. People don't think twice about it. So I was curious about the environment in Burma, but that's very good to hear that Burmese girls know that this is an option for them. That's excellent. So I know that obviously working in the medical field, that COVID-19 and the pandemic has had a dramatic impact on your career, just like it has on everyone around the world, but particularly on people working in the medical profession. So please share with our audience how COVID-19 has affected your work. And then I know that you've done some projects with the US government related to the pandemic.
Oh, okay, thank you. Actually, COVID-19 was a very tough situation for the whole world, especially for the medical professions like us. Even though I'm not a doctor who is currently working at the public hospital, but I have my regular charity clinics running around every week in the remote areas. So when the pandemic struck here, and the first wave in Myanmar was in 2020 March, we have found our first patient positive with COVID-19. So the government suddenly did the semi-lockdown, and they restricted gathering of more than 30 people all around Myanmar region. So the first difficulty that I have dealt at that moment was I have to stop giving the community services in the community, because like in our charity clinic, we have more than 50 to 60 patients every week. So we have a lot of people gathering there. So I have to close down the charity clinics for a moment. And also on the other hand, most of the public and private hospitals, they care much about the COVID-19 situation. They take care very carefully with the patient coming with the fever. And because that COVID was a very big issue, so many patients who have the non-communicable diseases, they got into trouble because they don't get the regular follow-up. They dare not to go out. They dare not to go to the hospital anymore because they were afraid that they might got infected with the COVID-19. So at that moment, I couldn't do anything, but I got an idea. We started, I have other volunteer doctors, so we started giving the medical consultation through online for those patients who need regular follow-up. And we had a new initiative called COVID-19 Medicine Support Initiative. We taught regular medication to their doorstep through the delivery services. So they don't need to go out to the hospital or the pharmacy to get their regular medication. And that was so convenient for them. And also we had supported more than kind of 80 patients with their regular medication. Yeah, that was what we have done during the COVID-19. And also you have mentioned the project I have worked together with the US Embassy. It was in late 2020 in December. It's called the Unified Movement. I think you might know that movement. I have organized the Share and Care project because I believe sharing is caring. So as to not only for the physical support, but also to help the youth, especially who were depressed by the COVID-19 lockdown. They have to stay at home. They can't go outside. They can't meet the friends. They lost their social life already. So I try to collect the stories, what they have been doing during their stay-home period. So if they want to share about their story and so they get an idea how to, so US Embassy has helped me organize this unified event, and we did the Zoom present 15 stories out of the many applications, and 15 participants have presented about their stories of stay home, and we chose the top 3 participants and we gave prize. And also I have got a lot of feedback from the other youth, and they can see doing why having the stay home lockdown period. So I hope that was a great help for all the youth. Yeah, thank you, Jason.
And Hsu was referring to an annual program that the Young Southeast Asian Leadership Initiative implements, which is called the Unified Program. And it's where we inspire, encourage, work with volunteers throughout Southeast Asia who want to do community projects throughout the region. So we'll put some more information in the description so people can learn more about that. And that always comes around December, but we start planning in advance. So I'm just curious, when you were gathering these stories for that program, was there one particular story or maybe one of the stories that you remember that moved you or surprised you? All right, audience, everyone's going to pray with me now that Hsu will come back. We're having a little bit of a technical issue, so let's see if we get her back.
Yes, like we have collected a lot of different kinds of. Hello, can you hear me?
Jason? I can hear you now. Yeah, we lost
Hello?
You for a moment there. You seem to be back. Please try again.
Yes. Sorry. So I got your question, and I hope you can hear me well now. We have collected different kinds of stories and for the Share and Care project, but I like to share about the story which really touched me. It was that story was about a medical student who lives in Rakhine State. Rakhine State is in the northern part of Myanmar. So because of the COVID-19, the university was closed for a moment. So he had to go back to his village in the Rakhine State. So there, he has nothing to do. He was like, he felt like he has no purpose in his life. But at a sudden, one day, when he went on a walk along the beach, and he found that some very young children doing fishing along, even though they are the age who has to go to the primary school, should be learning, should be studying. So, and at that moment, he felt that maybe I can help them, maybe he can help them, and he tried to organize, and he started teaching them English language. So it was a very nice one, because like he didn't have any classroom, any place, any proper training aids or training material. It was only his passion, because like if he stay at home, nothing will happen. But when he go out and he try to teach them some English and some lessons, it will be a very good, I'm sure that will be a great help for those children, because we are not sure that they are afford to attend the school, or they might be ending up their life going fishing along with their family fish. So I was touched by that story, and that story was chosen as the third prize for Share and Care project. It was a really nice one.
It is amazing how different generations and people at different points in their lives perceive things differently, such as with the pandemic. We received a question from the audience, and I do want to encourage our audience, please share your questions. This one is from Thi Ha Win, and Thi Ha Win would like to know a little bit more information about your experience in high school. And I'm going to ask the question this way. So we have a lot of people who want to be leaders and want to have an impact on teenagers, on adolescents. But obviously, as one gets older, you lose touch with, and you forget how you used to think as a teenager. So what are some tips that you pull from your own adolescent years that you use when you're trying to deliver messages about public health, or when you interact with them? What are some tips that you have for interacting with teenagers?
Oh, yes, I got your question. So to be honest, like my teenager life, I was brought up in a town called Tangji in southern Shan State. So I have stayed up to my 15 years of age. And my adolescent life was filled with excitement and also some of the bad memories, either being bullied or being discriminated among the other students as well. So at that moment, the one thing that in my mind is I just want someone who would be like someone who would lead me and who would take me out of the shell to think differently with the other people. I always wish I could meet someone or something, because like I just want to rely on that thing at that moment, because like adolescent life is too emotional, too fragile, and we can easily word or being from as long as I remember, I was too fragile and too emotional at that moment. I just wanted to be strong. I just want to protect someone, like some friends who were being bullied at the same time. And so I brought up my passion that I need to stand up myself first to help others. That was the first thing. I have to make myself strong before I started protecting the other people. I just wanted to be someone. So I tried my best. And when my family moved to Yangon, just for me to attend the medical university here, I tried to go to first thing that I have done after my matriculation was I went to the American Center. I read a lot of books. I talk with a lot of people. I attend the workshop, and I try to learn from those who were already being successful in their different professions. And I listen a lot, and I apply some of the idea while I building up myself, and I try to get myself preparative and always ready if there is any opportunity I want to grab. And also at the same time, when I get any opportunity, I share to the other people. I share to the other adolescents, other youth, because I don't want them to feel that they are being alone, they are being left behind, they were being discriminated. Because like in some part of the area before the internet connection was very much good here, most of the youth opportunities, most of the scholarship information, we don't get as long as we don't have very much great in touch with those who were in the very little sparkle. So now I don't want to hide any information, any opportunities. I want all of the youth to get equally. So that's what I try to make my adolescent and my youth leader life more meaningful by sharing. Yes, I don't have many big intentions of being other people's lives. Just by maybe my action or my words, I dream more. I think I'm being successful.
There's a lot of good advice in there, and one issue that you touched on was that adolescents are really searching to clarify their identity. Of course, that search doesn't finish when you get out of your adolescent years. We as adults are still working on our identity issues, but the point is to reach out to others and find that peer network and find people who are willing to be there for you. And bullying hopefully occurs a little less as you get older, but everyone struggles to find that peer network, and that is so important. We did get another comment from Thea Wynn, who said that Thea is very proud of our young generation, such as yourself, making a difference in Southeast Asia and Burma. And I do appreciate that as well. Now in Burma, in the last couple months, it's been very challenging because of the military coup. You've also had a lot of challenges in the past year and a half. About a year, where it feels like a year and a half, but slightly more than a year now with the COVID pandemic. So how are Burmese right now, how are they finding their support networks? I know you've had a lot of internet outages and various problems. So how are people finding the networks that they need, either to get the public health information they need or that mental health support? How are you finding people are staying connected with one another?
Yes, like because of the internet connection issue, it made people more difficult to seek for the public health information and also for the mental health support. But I believe that you have interviewed Joe from Call Me today. They also have created some channel on Telegram and also on the phone call. And also for us, like the public health doctor, we help the patient who needs our medical attention through the SMS, and they can call directly to us. And also we also have the channel to share the public health information on the social media if they can reach out to us. So that's all we can do at this moment. And also I told my patients, if they need some kind of medical attention or any consultation suggestion, they can call me directly to my phone or any of our volunteers' doctor phone. That's what we have been doing right now. But if I was still trying to share the more information as long as I'm connected to internet. I won't stop sharing about how to take care of themselves, how to keep your mind peacefully at this moment, because like mental health is very much related to our physical health. there is a Burmese saying that if we got mentally broken down, our physical health will also be affected seriously. So I try to motivate people and try to help them to keep themselves together at this moment, especially at this moment.
What is one big myth about COVID-19 that you would like to clear up if you could?
Oh, that's a tough question because like last year when COVID-19 has started spreading to other countries from the originating country, there have been a lot of wrong information related to COVID-19, and nobody knows very much clearly about the virus. But currently in our country, I feel like people are now forgetting about the COVID-19 because they are too busy to take care of current political conditions. So that this is not a myth or this is not a wrong information, but I just want to suggest our people from Myanmar that COVID-19 is still here. We can get it anywhere, anywhen, as long as we are not being properly protected. So I just want everyone to take care of COVID-19 whenever you go out, wear the face mask properly, to wash the hand properly, and not to go into the crowd. Yes, that's all I want to say at this moment.
That's a good one. We all need to stay vigilant. Now, I know that you spent some time in the United States. You participated in some academic programs and training programs in Florida and Boston at Harvard Medical School. Tell us a little bit about your experience in the United States.
Okay, so actually I was first time that I visited to United States was in 2016, and I got chosen to attend the training for medical leadership program at the Jacksonville Mayo Hospital in Florida. So that was to admit that was my kind of a very first trip alone by myself to another continent from Southeast Asia. That was so exciting, and I had a lot of memories, and also the great remembrance was I was the youngest among all the other participants. So there I have found that there are a lot of doctors and a lot of medical students who are working passionately for their community, for their country, and that was so great for me, and I felt myself so lucky to join that training. I got a lot of ideas for the community work from there, and also about the leadership, not just to be a leader, but also to how to work, how to be a great teamwork. So I learned a lot there. So that was my first experience in United States. And again, in 2018, I applied a scholarship to join the Harvard Medical School because that I was I was so crazy about the Harvard Med School. I have seen in a lot of movies, and I have been dreaming of going there one day. So I tried. I didn't expect myself to get the scholarship, but I tried. And yeah, I made it. So I have joined that program for the Harvard Med School it's called Southeast Asia Healthcare Leadership Program. So it's like a healthcare management program, but they emphasize for the healthcare system from Southeast Asia. So it was a blended program, and I have to learn mostly online, but during the last module, I have to go to Boston and attend at the Harvard Med School. Wow, I felt like I was, but I feel really happy. And the thing that I learned from that Harvard Med was very effective and very helpful for my community work because we have to do the capstone project at the end of the program and to improve my community care and how to maintain the effective community work, not just being a leader on the chair, but to be a leader at the ground level, know everything, and also share the common goal with the other volunteers and also the patients. That was a very great thing I have learned. And another great remembrance was when I was in Boston. It was in February and 20 degrees Celsius. Really great experience. I will never forget that. Yes.
We have a comment from Sai Win, who says, in this terrible crisis, most of youths, including me, in Burma, are feeling depressed, horribly depressed. So a lot of people are struggling. We're very aware of that. And I talked to George last week, and he has his crisis helpline, and I definitely recommend people call that helpline if they need assistance. What are your recommendations for youths, particularly in this last couple months with so many trials and tribulations? What's your recommendation to help them stay focused, stay positive, stay energized?
Yes, it is very important for us to stay positive at this moment because myself, either I feel depressed and I feel like I'm lost. I don't know what to do tomorrow because we don't have any plan. We can't do any planning ahead because we are not sure of what will happen to our tomorrow. But I would like to suggest most of the youth to try to focus on one thing and try to do what you love while staying home. I know it's difficult for us to concentrate on one thing at this moment, especially to do the study or to learn new things, because I'm sure that most of us are feeling purposeless at this moment. But if we keep doing something we love, something we believe, we focus on something and trying to improve ourselves somehow, that will be useful one day. If we get any opportunities in our hand, we will be ready. So being depressive at this moment is okay, but we can't be depressed all the time because we have to survive this situation. We have to live our lives. We have to grow together. So I believe that we are the only person who can make us survive. We have to try ourselves and do things we love and spend more time with the people we love, show more care to each other there. And by also in a religious way, we can do meditation, also listening to the some music, and that will help us to feel better. So try to see things positively because now we have to stay at home mostly. I believe that we have more time to spend with our families rather than going out because we were too busy going out, going on working, travel. We missed to take care of each other. So I feel like it's better for us to stay at home and spend more time with the family. Yes. So, and as I mentioned before, do things which we love and try to learn new things as long as we have our internet connection, and also we can read some books which can change our perspective of thinking at this moment, be more positive.
Even in a moment of crisis, as you said, we can concentrate on what we can change. We can work on ourselves, we can work on our leadership skills or our mental health, or work with our families and do what we can, develop new skills. There's room for growth, even in moments of crisis. Do you have a leader who inspires you, either an American leader or someone in Burma that you think of who's dealt with moments of crisis and kept going? It could be in the medical profession, but it doesn't have to be.
Actually, I have met. Yes, actually, I have met that person. If that person is not a famous leader, but I have found that that person survived his most difficult situation of his life, and still he tried to show his care and his passion on the patient, even though out of his difficulties, and also guide me to become what I am currently today. He was the one who motivated me and who has showed me. He didn't teach me anything, but he showed me by being himself how to be a great leader, how the great leader talk, how the great leader act, how the great leader take the responsibility. He showed me everything. So I felt myself so lucky to work with him once in my life, and that person was my role model, my leader, my teacher, my mentor, and someone whom I will always remember. I have met that kind of person. He is from the medical profession, and now he's not here anymore. He left us.
We all need people like that in our lives. Now, I know a lot of people are paying attention to Burma right now because of the incidences in the last couple months, and they're seeing a lot of horrible images of Burma, and Burma not in its best moment. So I just wanted to ask you a more positive question. You mentioned that during COVID-19, a lot of people are staying at home, spending time with their families. What is one of your favorite Burmese holidays that you would like people to know about?
Okay, yes. My favorite Burmese holiday is coming soon because it's in April. It's Burmese New Year. We call it Dintan Festival. Every year we have a long holiday and kind of a reunion with the family, and we visit to our elderly. We pay respect. And yes, that's my favorite holiday. But unfortunately, we have missed to celebrate our Dintan holiday last year because of the COVID-19. And again, it's coming soon, but we can't celebrate it yet. And I'm expecting that we can celebrate our Burmese New Year in a very near future. And I believe that everyone does the same.
And I hope I get to visit Burma in a future year in April and meet your family and celebrate the new year with you. So we are coming to the end of the interview, and I would like to give you an opportunity to address our audience in Burmese, if you would like. Do you have a message for our audience?
Yes, I have some message. So can I speak in Burmese?
You may.
Yeah, bye. Okay. ဒီနေ့ဒီ live session လေးကိုကြည့်နေကြတဲ့လူငယ်တွေမောင်နှမတွေဒီမှာမောင်လေးညီမလေးအားလုံးကိုကျေးဇူးတင်ပါတယ်ဒီလိုကာလမှာအကုန်လုံးကစိတ်ညစ်နေကြမယ်စိတ်တက်ကြနေကြမယ်ဆိုတာလည်းသိပါတယ်ဒီအစီအစဉ်မှာကျွန်မဒီ interview ကိုဖြည့်ဆိုတဲ့အချိန်မှာလည်းအကုန်လုံးကိုပေါ့နော်ဒီလိုမျိုးစိတ်ခံစားမှုဒီဖြစ်ပျက်နေတဲ့အရာတွေအားလုံးမှာဖြစ်ခံစားနေရတဲ့စိတ်အားငယ်မှုတွေစိတ်တက်ကြတဲ့အရာတွေအားလုံးကနေပြီးတော့မှခဏတာဖြစ်လွတ်မြောက်ပြီးတော့မှဘာလုပ်ရမလဲကိုယ့်အနေနဲ့ကိုယ့်ရဲ့ဘဝစီလံဘယ်လိုရှေ့ဆက်ရမလဲဆိုတော့ idea လေးတစ်ခုရလာမယ်ဆိုလို့ရှိရင်တော့ကျေနပ်ပါတယ်တက်နိုင်တဲ့လောက်ပေါ့နော်ပြီးတော့ဒီ US Embassy ကနေပြီးတော့မှ ပြုလုပ်တဲ့ဒီ leadership program တွေ training တွေခု online နဲ့ပတ်သက်တဲ့ online workshop တွေကိုလည်းတတ်နိုင်သလောက်ပါဝင်ပေးဖို့ပေါ့နော်ပါဝင်ပေးလို့ရတယ်ဆိုတဲ့အကြောင်းကိုလည်းဒီကနေပြီးမျှဝေပေးချင်ပါတယ်။နောက်အထူးသဖြင့်ကတော့အခုလက်ရှိမှာကျမတို့ဒီလူငယ်လေးတွေအများကြီးပေါ့နော်လက်ရှိဖြစ်ပေါ်နေတဲ့အခြေအနေကြောင့်မလို့သက်ဆုံးရှုံးရတာရှိရဲ။နောက်တချို့တွေဖမ်းဆီးခံရတဲ့ခဏတွေရှိရဲ။ဒီ medical profession တွေကနေဆိုလဲကျမ junior ဖြစ်တဲ့ဆရာဝန်လေးတချို့လည်းဖိနှိပ်ခံရတာရှိရဲ။သူတို့အတွက်ကိုလည်းကျမအနေနဲ့အရန်ကိုဝမ်းနဲ့ကြေကွဲရတယ်။နောက်ပြီးတော့မှဒီဖိနှိပ်ခံရတဲ့ကလေးတွေကိုလည်းအများဆုံးပြန်ပြီးတော့မှညှင်းညင်းချစ်ချက်နဲ့ပြန်ပြီးတော့လွတ်မြောက်စေချင်ပါတယ်။အားလုံးကိုလည်းတစ်ချိန်မှာပေါ့နော်ဒီထက်ပိုပြီးတော့မှကောင်းမွန်တဲ့youth opportunities တွေနဲ့တွေ့ဆုံပြီးတော့မှနောက် workshop တွေမှာလည်းအကုန်လုံးနဲ့တွေ့ဆုံပြီးတော့ရင်းနှီးစကားပြောချင်ပါတယ်။ကျေးဇူးတင်ပါတယ်။ Okay.
And for our audience who does not speak Burmese, you don't have to translate word for word, but in general, what did you say?
Yes, it is just like I know that everyone right now, everyone who is watching this live interview, I'm sure that you all are feeling desperate and depressed because of this situation. The main purpose is to help with some of you to have some motivation at this moment, or maybe just free from some anxiety as for just for a few moments while watching this YouTube section. So, and also I have seen that most of the younger generation, most of the youth are now feeling lost. I just want to tell them they can grab some opportunities by the U.S. Embassy because U.S. Embassy has a lot of youth development programs and online workshop, online sessions. So we can do something at this moment as we have the internet connection right now. And also I have added some words for who were lost their life during this situation, and some juniors at this moment. I feel who have lost their families, and also as soon as possible. And I want the whole situation.
Well, thank you for those words. We obviously started to have some tech issues there, and we're so grateful that you were able to join us today, Hsu. We were a little worried throughout the day because we have experienced some tech issues in Southeast Asia, and in Burma, there have been a lot of internet connectivity issues. So we're so hopeful, so grateful that we were able to have this conversation. And the American community and the diplomatic community is very, very hopeful that better days are ahead for Burma. And as you said, the embassy has lots of ongoing programs for youth and people in Burma, lots of community improvement projects. So we encourage everyone who's listening to the show to look at the platforms of the embassy in Rangoon for the programs that they have, and to also look at the mission to the Association of Southeast Asian Nations, and of course, our program for the Young Southeast Asian Leadership Initiative. We have lots of programs. We'll put the links in the description below. So again, just thank you so much. Thank you so much for joining us for this conversation. Lots of inspirational advice. And I do wish you the best, and I look forward to meeting you in person, hopefully soon. All right, thank you so much. And thank you to the audience for listening in. I look forward to the next show. Take care, everyone.